Hi everyone, welcome to my channel. In this video, I will talk about the part 2 of the clavicle, where I will talk about the attachment, the clinical, and the important question your examiner may ask. So before moving into the video, if you have not subscribed my channel, then do subscribe it, hit the like button and share with your friends. So let's move into the video.
First is the attachment. So I have divided the attachment into three parts. First is the joint, capsule and the ligament. Second I will say about the origin and next about the insertion. So let's start with the joint, capsule and the ligament. The joint capsule is present in the acromioclavicular joint. Okay, next is the fibrous capsule is present in the sternoclavicular joint in the medial part. Articular disc is present in the medial part posterior superiorly and the interclavicular ligament is present superiorly in the medial end. Next we have the attachment of the coracoclavicular ligament. Coracoclavicular ligament is present in the conoid tubercle and in the trapezoid ridge. This is the trapezoid ridge and this is the conoid tubercle I have said. So this is here the coracoclavicular ligament is present. Next, what I will say about the costoclavicular ligament. Costoclavicular ligament is present in the oval impression in the inferior surface of the medial end. Here there is costoclavicular ligament. Next is the clavipectoral fossa. Clavipectoral fossa is present in the subclavian groove boundary. So this is the subclavian groove in the inferior part and here in the boundary we have the clavipectoral fossa. Now here is the joint, capsule and the ligament. Next about the origin. So first the origin of the lateral 1/3. So in the lateral 1/3 there is the presence of the deltoid muscle anterior border. So in the anterior border the deltoid muscle origin is there. Now the medial 2/3. In the medial 2/3 in the anterior border the origin of the pectoralis major muscle. And in the superior part, there is the clavicular head of the sternocleidomastoid muscle. Next, in the posterior surface, here we get the sternohyoid muscle. So these three are the origin in the medial 2/3. Now, let's go and start about the insertion. Insertion of the lateral 1/3. This is the lateral 1/3, the trapezius muscle in the posterior border. Okay, and the medial 2/3 there is the insertion of the subclavius muscle in the subclavian groove. So this is the subclavian groove and here the insertion of the subclavius muscle. So this all are the insertion and origin of the muscles. So now I will talk about the clinical. So the most common site of fracture is in the junction between the two curves of the bone. This is a curve and here this is one more curve. So this is the weakest point of the clavicle where it gets fractured frequently. It is commonly fractured by falling on the outstretched hand by displacement of the lateral fragment downward. Now next we have the cleidocranial diastosis. In the cleidocranial diastosis there is a totally absent of the clavicle congenitally or there is imperfectly development of the clavicle. Okay. Now the most important question your external may ask. So first question is the peculiarities of the clavicle. If you get the clavicle bone in your exam, then trust me, this is the most important question your examiner will ask. That is the peculiarities of a clavicle. So only 5 peculiarities you have to remember. First one is this is the only long bone which lies horizontally. Okay, and second one, it is subcutaneous throughout its origin, and third is first bone to ossify. This is the first bone which ossifies. Fourth is shows a membranous ossification. Fifth is it has 2 primary ossification center. So these 5 are the most important things you have to remember in the peculiarities. Last one you can say or you may not. That is occasionally it is pierced by the middle supraclavicular nerve. Okay, this is the first question. Second question your examiner will ask is the common site of fracture and the attachment of the clavicle. It doesn't have a lot of attachment, so you have to remember all the attachment it has and all the important features it has. Thank you. If you like our video, then subscribe to our channel, hit the like button, comment below and share with your friends. And for more updates, follow our Facebook, Instagram and Telegram pages.